If you're a parent of a kiddo with OCD, it's nothing that you did that caused them to get OCD. It's nothing that you could have done. This is just something that was going to unfold over time. So please don't blame yourself. Now, the most important thing is to think about what your next steps are. Now, we know that this type of therapy is the most effective treatment possible, cognitive behavioral therapy with exposure response prevention. We also know that medications are very effective too. In the most severe cases, we want to go with a combination, but in more mild and moderate cases, we really want to try to use that cognitive behavioral treatment alone to have a successful outcome. Now, one of the nuances that's really important of this type of therapy is to have a very, very strong exposure and response prevention component to it. The other part that I think is really important is to make sure that you're involved in your child's treatment. Now, one of the reasons this is so critical is that you're going to need to take what your kiddo learns in session and help them apply it all around throughout their week until that session the following week or whenever that might be. And it goes to that old notion of, again, practice makes perfect, but you have to practice in a variety of different settings to be as successful as possible. And sometimes in a therapist's office, there are only so many things you can do, so you have to extend it outside of the office into your child's kind of real life environment. Now, the other thing that happens in 100% of cases is that kids will go to their parents to seek reassurance or help with their OCD. We call that family accommodation. Now, here's the thing. Family accommodation is a normal reaction. So to help your child when they're distressed, this is what parents do. I'm glad that you probably are doing it. But in the case of OCD, it's something that we want to gradually pull back on because family accommodation not only makes your life more difficult, but it keeps the whole OCD cycle going by virtue of you now doing the rituals on behalf of your child, as opposed to them kind of learning that what they're afraid of happening isn't going to happen. So the only way to really learn how to do that, I think, or the best way, is to be a participant in your child's sessions so that the therapist can guide you on how to pull back your behavior and then what to do depending on your kiddo's response, which could be that they get really anxious or even really angry or teary. But what we know is that when we have a kiddo with OCD and we have a parent who's engaged in treatment together with a therapist who has good experience in working with this condition, our chances for a successful outcome are tremendous. If you're worried about your child having OCD, there is availability of incredible information, rich information online in the International OCD Foundation or the Peace of Mind Foundation websites. Now, this will just be an initial first step. It'll help you understand if this is something that you should be, in fact, be worried about, but it will also help direct you to potential providers. Now, one of the key things with a provider, or finding the right provider, is that you want to make sure that they have experience in working with OCD. If someone doesn't, sometimes it's a little bit tricky to provide that level of care and individualization of treatment that you might really want in order to have your kiddo have the best outcome possible. Both of those websites can help guide you towards appropriate resources, as well as our program here at Baylor College of Medicine, where we're able to see folks as they come through, but direct people to other resources as appropriate.